welcome distinguished guests, ladies and gentlemen. Well, what I think of this talk, when I started to prepare, just out of a simple mind, if surgery has been coded, I mean in the metabolic surgery field, very simple message always echo in my mind. Surgery can cure the disease and you can stop all the medications. So this message has been echoing in my mind for quite a bit of time. And then I think if obesity has caused so many complications and caused so many diseases in your life, that is going to cost you a lot, not only from the from the patient perspective, but also in the whole healthcare system as a whole. And then I think of, do we have a number? If I do a surgery and get rid of everything, is that even if the surgical procedure is expensive, that should be cheaper than your whole life in terms of health or all kind of healthcare expenses. But it's that simple. I'm not very good at economics and also mathematics. For your information, I only studied 10 months of economics in my secondary school, but now I have to deal with this talk money. And then I found that there's actually another specialty called health economist, who should be given this talk instead of from clinicians. Now, I cannot actually give you an exact figure, but here's the information. Now, everybody knows that obesity has now become epidemics in all of the world. No place in the world can be spared. But this epidemics can be translated to increased economic implication of healthcare expenditure. But exact figure-wise, well, the numbers rise, expenses, and also just now presented by Professor Cordis, the expenses in Australia is also expensive. Now, I want to quote this paper. For your information, I know well in our theme of our society is all range treatment for all range of disease, but this paper, since published, is all for surgically eligible patients. It has been quoted more than 6,000 times in the publications, and quote, metabolic surgery is effective any other treatment options if you're using to treatment obesity-related complications, like more ranging from approaching 50% to 80%, regardless of whatever surgical procedure you are offering to the patient. And if you're looking detailed, zoom your scope to diabetes alone, regardless of whatever procedure you're offering to the patients, it provides durable with a significant proportion of resolution of diabetes. And therefore, if a lot of healthcare costs is related to diabetes, can be resolved and can be saved. Now, another landmark study is SOS. This is very famous and against as most highly quoted large-scale paper. It has been quoted myocardial infarction can be reduced by around 40%, mortality reduced by 30%, and the surgical-related mortality is very, very low. Now, mind you, if one patient suffers from one episode of myocardial infarction, the cost is already more expensive than surgical procedure a lot. The reasons showed you has been scientifically proven. Whatever surgical procedure are you offering to the patient, it can significantly reduce microvascular complication or macrovascular complication result from diabetes. It is proven, and therefore the complications or the comorbidity results from all these vascular complications. And these numbers are all from local data. Diabetes, 10% prevalence. 1/3 of overweight people has diabetes, but more than 85% of diabetes are overweight. And in Asia, they're younger than those of Caucasians.